Welcome. I'm Dr. Joseph Vassalotti. I am Chief Medical Officer of the National Kidney Foundation. I'm Clinical Associate Professor at Icahn School of Medicine at Mount Sinai in nephrology. I'm here to discuss helping your patients with chronic kidney disease at the American College of Physicians, Internal Medicine 2019. I wanted to discuss CKD metabolic acidosis. You should think about that when the total CO2 or the serum bicarbonate is less than 22. Think about CKD metabolic acidosis. Typically, that's going to appear when the GFR is less than 40. In the CRIC cohort, that was about 39% of patients with a GFR less than 40 had a TCO2 less than 22. Before you consider the patient has CKD metabolic acidosis, of course, you want to rule out respiratory alkalosis, which can cause a low TCO2. So if you have an anxious patient or a patient who has other risk factors for chronic respiratory alkalosis, certainly you should consider doing a venous blood gas to confirm the patient has CKD metabolic acidosis. There are 4 randomized trials now, small studies with follow-up between 6 months and 2 years that have shown when patients are randomized to sodium bicarbonate alkali therapy versus placebo, there is preservation of kidney function over time, and there is a lower risk of kidney failure or the need for dialysis or transplantation. So there is an accumulating body of evidence that alkali therapy, typically in the form of sodium bicarbonate, which can be 650 milligram pills, which is 7.7 milliequivalents per liter of bicarbonate, or you can prescribe sodium citrate, which comes as a liquid. Every 30 cc's would be 30 milliequivalents per liter of sodium bicarbonate. And then, of course, you can go to your supermarket and sodium bicarbonate is available, and the powder can be mixed with liquid or water, and that can be used if a patient has difficulty accessing the sodium bicarbonate pills or the sodium citrate liquid, or if they find those products to be impalatable, the sodium bicarbonate powder and baking soda, for every 30 ml, that's 54 milliequivalents of bicarbonate. So that's probably the most potent of the 3. And then lastly, I would be remiss if I didn't mention that the major source of acid-producing food is processed meats. So if your patient reduces their intake of processed meats, that may help them. If they eat more fruits and vegetables, that's been shown to increase the alkaline load. So more of a plant-based diet may actually be a type of alkali therapy that doesn't involve medications. That might be something to consider if you have a motivated patient who's willing to go in that direction.